We had recently the IHI BMJ forum in Copenhagen, and we gave a session. Several of us, Gabby and I, were on the session, and Bob Klaber, our kind of magnetic personality that brings us together from all over the world, as Joran was saying. And so we thought what we would do is just summarize what we talked about there and why we think that we're trying to work on some two aspects of kindness. One is, how can we give people very practical ways to use kindness in their everyday work, especially in such a time of stress. I think that people were saying, can you give me some very practical ways to think about how I can change the way I think and the way I work? And the second bit that we've been working on is, as Joran was saying, doing some research into thinking about what is the outcome of changing our culture. As he said, sometimes we're thinking about this from the perspective of the workforce. When people are really tired and burned out, what does kindness mean there? To patients and families, are we seeing better clinical outcomes? Are we seeing actually what we predicted, which is lower costs, because people are telling us what matters to them? And then with families and friends, and I had the experience yesterday of being with my sister when she underwent some major surgery, and nobody said the words "what matters to you," but everybody acted in that way. And it was quite an experience to watch them treat me, the sister, as just a part of the care team. And it was great. So we wanted to share with you a little bit about what we went over in Copenhagen, and then open it up for some discussion, some conversation, and get some ideas from you. If you go to the next slide, this all started some years ago. This is Bob's tweet that he sent out back in 2019. And Bob had been sitting in a session that Don Berwick and I did at one of the forums. We were talking about things that we used to think, and then how our minds had changed over our careers. So we created a list of things that we once believed very strongly in and did, and then how we have changed. And one of them was about this kindness. And Bob was sitting, I think, in the second row of this big giant room. And I remember afterward he came up. I didn't know who he was at that point, and he told me that he had always thought that kindness was a soft and fluffy thing. And after he heard us talking, he was inspired to think about it in a very different way. And he sent out this blog, including a slide from one of our senior fellows at IHI, Len Berry, who's done amazing studies on kindness in cancer care. And so Bob kind of began to bring us all together. If you go to the next slide, and we started to plan, we were going to do a session at the next forum on kindness. And so a group of us, Bob and Gabby, James Mountford, Susie Bailey, Joran, Annette Nielsen, Dom Allwood, Kath Kroc, and Nikki, we started, some of us started meeting every month by phone to plan the session that we were going to do. And then COVID hit, and we had to do it virtually. But I remember we did that session to the forum, and at the end of it, we said, we have been meeting once a month to plan this session, and we have gotten so much out of it that we're never going to stop. And if any of you want to join us, our next call is tomorrow. And we had 63 people from around the world say that they were interested in joining us. So we've been having this call ever since. We've been learning from everybody on the phone. It's basically a global compilation of ideas and tools and research. The next one, the next slide, was we now have had 1,100 contributors from 31 countries on these monthly calls. So when you go into the breakouts in a few minutes, and when you're tonight thinking about trying to fall asleep, I'm going to encourage you to think about what brings you to the call today. What passion might you want to bring? Is there research? Are there tests that you wanted to try with your team at work? How can we together add to this amazing global contribution so far. The next one. So over these months, we've been thinking about what does it really mean? And 30 months into the conversation, these themes have emerged. First of all, that kindness is a choice that we can all take, we can model, and we can lead. As Joran said in his introduction, we're finding more and more that we need a new leadership model in healthcare. The old model was focused on technical things, on the science of management, on managing people and managing budgets and buying equipment. We really need a new model in leadership, and we would love to co-develop that with everybody on this call. Leading with kindness needs to be central. Just a couple of these, and you'll have all these slides to use, but I think the one in the middle turned out to be particularly important, and that is that we need to challenge when we see unkindness in daily work. If we just walk by it every single day, the culture is never going to create a warm and welcome place for us to create kindness. So the next slide. So what we set out to do was to help people to think differently about kindness and to feel mobilized and equipped to act. We want to share a few tools with you today, and then invite you to join. If you go to the next one, what we're learning here, this is from the King's Fund, is that at work, it's absolutely core. The paper here was written for nurses and midwives, but it applies to everybody. And I think it's the ABCs of leadership, that people at work need to feel autonomy. They need to feel like they're in control of their daily work. They need to feel belonging. They need to know when they're coming together that they're working in a team. Joran is our team expert. He's a basketball coach and manager and has helped us to learn from athletics and sports. How do you build an effective team? I never learned that in graduate school, but it's absolutely pivotal to our work today. And contribution, people need to know that they're making a difference into people's lives. So Gabby's going to read you a poem that mobilized us to think in a new way. Gabby?
Yeah, so this is a poem that Susie actually read in Copenhagen. So if you're there, you'll have heard this before. But to me, it just picks up on loads of the small things. One of the themes of ours is that little acts of kindness can often go as far as bigger acts. So I will read this to you. It's called Small Kindnesses by Danusha Lamiris. I've been thinking about the way when you walk down a crowded aisle, people pull in their legs to let you by. Or how strangers still say, bless you, when someone sneezes. A leftover from the bubonic plague. Don't die, we're saying. And sometimes, when you spill lemons from your grocery bag, someone else will help you pick them up. Mostly, we don't want to harm each other. We want to be handed our cup of coffee hot and to say thank you to the person handing it, to smile at them and for them to smile back, for the waitress to call us honey when she sets down the bowl of clam chowder, and for the driver in the red pickup truck to let us pass. We have so little of each other now, so far from tribe and fire, only these brief moments of exchange. What if they are the true dwelling of the holy, these fleeting temples we make together when we say, here, have my seat. Go ahead, you first. I like your hat. That, like when Susie first read it to me, just made me smile so much. But I think is, in a way, the way that a lot of people often think about kindness, that it's really soft. And I think what we're trying to say is actually those small things are what make the biggest difference in a hospital. So a lot of the work that we've been doing as we came together and when we set up this call, we weren't sure about how we were going to try and bring people together. And this call is an example of that. Like we were meeting anyway, monthly and planning for our first presentation. And we decided to open that up to friends and to all of you that are here today. And we've been reflecting on the work of Marshall Gantz, and some of you will know him. And he talks a lot about how you can make change through the power of narrative and storytelling. And his model is 3 parts. How can we tell a story? That's Marshall Gantz, by the way, just for before I move on. How can you tell the story of self? So what matters to you, who you are and why you do what you do and what you stand for. Connect it to the story of us. So why are we here on this call today? and then finish that story with what now. And often with these calls, it's very simple in that we've come together, we open up by introducing ourselves. We normally reflect with a speaker at the start, and they'll share why they believe this is so important. And then as we move to breakout rooms, we get an opportunity to come together and think about what now. And I find this really helpful in how we think about change. So what we want to do now is Maureen's going to tell you a story from her life. I'm going to tell you a story from ours, from mine, and then we're going to move into the breakout rooms where Maureen will give you a little exercise to do some storytelling of your own. So I'm going to hand you back to Maureen now.
Thank you. I have learned so much from Marshall Gans. He's amazing. My office used to be right across the hall from his, and whenever I would be thinking about trying to communicate something challenging, I could just take a walk over, and he was an amazing way. His way of helping us to understand changing culture, moving people was, as Gabby said, in that 3-part series. So I'm going to tell you a story from my mother. So I'm the oldest of 9 kids, a huge Irish family. Last Sunday, just a few days ago, we had an annual, the annual party where everybody in the family comes to my house. There's 61 of us in my immediate family. And everybody came to the house. It did rain all day, but we had a wonderful time. And mostly it was about telling stories from our past. It was my mother's birthday party, and we've had it every year. And it was just an incredible experience for us because we're telling stories about my mother to the little kids who never got to meet her. And it's keeping that legacy and that lore in our family alive. My mother was an amazing woman. This was her birthday party, and we were all, we took her out to a restaurant. You can see how, like, she's so humble and warm. And a few days after this, I found my mother lived with me. I found my mother unconscious, and she was brought to the hospital and admitted to the intensive care unit. And I remember she was intubated. She had IV tubes and all. And after about a week, one of the doctors asked if he could have a family meeting. And so we had to get a conference room because there were so many people, obviously. But we all gathered in, and there were 2 people in the room, her nurse and this doctor. And he sat down with us and he said, "Tell me about your mother." And I said, "She's 78, she has diabetes, she's had bilateral knee replacements." And he put his hands up and he said, No, tell me about your mother." And my brother, the troublemaker one, he stuck his hand up and he said, "She loved me best. She always told me that. She used to call me every day and tell me she loved me best." And we all started laughing. And for 1 hour, we sat and laughed and cried and told stories about what my mother had meant to us. And it was the most incredible experience for all of us to be there. And having him say, no, tell me about your mother, was such a lesson to me. At the end of that, another doctor walked in, and he stood up over us and he said, "Your mother is going to have a trach. She's intubated. I'm going to put a trach in her neck so she can breathe. We're going to have to try and find a nursing home that takes care of those kind of patients. I don't know. It's really hard. And she's going to have a feeding tube inserted. And it's going to be a lot of work for me." And then he looked down at his watch and he said, "I have to get back to work." And my brother, the troublemaker, he said, "Oh, because my mother's dying, she's not your work." And I sat there and I looked at these 2 doctors, the nurse and the doctor, and the ICU doctor, and I said, "This is the doctor for her body, and these are the people for her soul. And why can't we bring these together? Why can't we create a way for my mother to go forward?" And at the end of the hour, when the doctor for her soul said, "What would your mother say if she was here?" We all had a conversation, and we said, "My mother would say, 'Take me home.'" And so that's what we did. The CEO of the hospital, who was a friend of mine, came up and he said, "Is there anything I can do for your mother?" And I said, "No, unfortunately, there isn't." and the stroke infarcted her brain completely. And he said, "Is there anything I can do for you?" And I said, "Absolutely. You can stop visiting hours. You can stop separating me from my mother in her last days of life." And he said, "We don't do that." And I said, "Yes, you have visiting hours, and they're very strict." And he said, "No, we don't." I said, "Come with me." I took his hand and we walked up to the ICU unit where my mother was. This was her door. It's locked all the time, big stop signs. There's a telephone outside. You have to call in to get permission. And of course, being a quality nerd, I kept a control chart on how many times I got to go in. And it was about 90% of the time, they would say, "Oh, we're really busy right now. The doctors are making rounds." That nurses would put paper over those windows so that you couldn't even look in. We were totally kept away. I said to the CEO, "Come with me," and I showed him where we slept on the floor on mats that we took off cots. And a week later, the CEO called me and he said, "Will you come visit?" And this is what the ICU looked like then. It was completely different. The doors were open. It took a while for the culture to change, but the processes really led to a culture change there. And I keep thinking back to what would my mother be thinking? What would my mother be saying? And she would have said, "Don't separate me from my family. Don't lock me out." She needed us at that moment, although she wasn't conscious, and we needed to be there to take care of her. And so it meant all the difference to me that that I was able to both ask that doctor said, "What would your mother say?" And we got to take her home. We had the most beautiful death a week after she was home, but we all got to take care of her. We all got to have our jobs, and it meant everything. And how can we change the culture to move from the doctor for your body to the doctor for your soul? Gabby, back to you.
Oh,
Thank you so much, Maureen. So now I want to share a story about myself, actually. So for those of you that haven't met me, and some of you will have heard this story in Copenhagen, I live with 3 long-term conditions. And for the most part, it's okay. I've had them for a while and I know how to deal with them and what I need. But in June of 2021, I was diagnosed with my most recent one, which is a form of arthritis. And when you have a new condition, as much as you're figuring it out, your doctors are also trying to figure it out. So it's a constant pattern of hospital appointments, trying medications, blood tests, seeing what works and what doesn't. And while I was at university, somehow there was quite a lot of flexibility in being able to do that, in being able to be unwell and find the time to go to appointments and rest when I need to and make my own schedule. But last summer, I was coming up to starting a new job. And I was really nervous, actually, about how a condition that I didn't know how to manage and I didn't know how it would impact my life would melt and fit into work and day-to-day life and a busy schedule. And I got sent some forms as I was starting to fill in about my needs and my conditions and what adjustments I might need and what I'd want my team to know. And I spent a really long time filling them in. I remember sending them to my mom and seeing about the wording and trying to explain about how sometimes tiredness could affect me and I might have flare-ups, but also that I don't know about my flare-ups and that I might occasionally have hospital appointments that I'd have to leave for. And I filled it into the best that I could and sent it off and thought nothing more of it. Assumed that everyone I worked with that needed to know would know, and that day to day, if I need adjustments, I would adjust, and people around me would adjust, hopefully, as well. And went in with optimism. And so the year went on. I started working from August, carried on. My joints were okay. I had a few flares that came and went. I had appointments that I had to leave early to. A few times I was late because medications ran out and the pharmacy wouldn't give them to me. I'd have to go in the next morning to pick them up before work. And one day, it was the afternoon at work, and my joints somehow had really started to flare, and I got a nice drink from Costa, and I hadn't even realized I was doing it, but I sat in the office holding the cup against this joint in my hand, and I don't know why, but recently it's been this hand that it's starting on. So I was sitting there holding this cup, this ice cube against my hand through the cup, and not even noticing that I was doing it, just sitting there thinking through what I had to do next and taking a moment. And someone that I work with every day, my registrar, walked in, and he looked at me with such shock and confusion and was like, "Are you okay?" I was like, "Oh yeah, no, it's just my joints. I think they're starting to go." And I've never seen someone look more confused. He had absolutely no idea what I was talking about or what I was doing. And it was then that I realized that all this year where I'd been leaving early or missing things or saying no to opportunities because I was worried about it, that actually the people around me had no idea. And we sat down and started talking, and he asked me about it and what it meant and like why my joint was swollen. And we had a really, really great conversation. But I was absolutely shocked because for a whole year I'd been the only person trying to make adjustments around me and my condition. And somehow the system and the processes had totally failed and no one had managed to find it out. And luckily there was someone like the chief exec that Maureen had that was able to hear and had been really flexible anyway, without asking questions, without knowing, to help me be able to do my job and work day to day. So what I didn't mention is that the new job I was starting was as a junior doctor. And obviously coming into a job like that when you're working really long hours and you don't know what your schedule will be like and you're working long shifts probably for the first time is really scary. But I think what that really pushed home for me is that a lot of the time where people need people to listen and systems to listen, we don't quite have that. And the way that it often works is by having people that kind of stretch the rules or make allowances where they need to, because often the system fails to catch us. So that conversation was really important to me, and I'm really lucky that I get to work with a team that supports me day to day like that. But that isn't the case for most people. So we're going to talk a little bit about storytelling, and then hopefully we'd like to hear some of your stories in a similar vein. So one thing about storytelling that you all do, like I think we often say we do, but we think we're not great at, is listening. And a huge part of when people are telling a story is being able to listen, and not just listen to respond, but to listen with fascination and to hear what the other person is saying. And this drawing just plays out some of Nancy Klein's work about listening with fascination, and hopefully you can have a closer look at it later, because I want to move on to be able to time for some storytelling. And this last one is about how storytelling can be so magic. You can pick the time, you can set the setting, and it doesn't matter where you are or what's going on, but how you reach out to your audience, how you make eye contact, how you use your speech or your use of photos, like Maureen's use of photos with the ITU doors to really illustrate what you're saying, can be really powerful. And I'm now going to hand over to Maureen to set the exercise.
So we're going to have some time for storytelling and listening. And I wanted to just start by telling you one more quick story about one of my very close friends who was the CEO of a big academic medical center, different CEO, a big academic medical center. And I noticed some of you in the chat were saying, how do we improve our listening skills, especially as leaders? So what John would do is once a month, John, the CEO, would have a breakfast, and it was in his boardroom. It was a really nice breakfast. Everybody always wanted to go. And he would invite any employee who had been a patient that month, or they had had a family member. So if you had been a patient in that hospital or that health system, or your family member had, he would invite you to breakfast. And everybody would come and they'd sit and get their food and sit and start talking. And then at some point, John always stood up with a flip chart next to him and he'd say, okay, tell me what rules you broke when you were a patient so that you could make your care better. And everybody would say, no, I didn't break any rules. And he said, look, I know you broke rules to make your care better. You have to tell me so that I can break the rules and make it better for everybody else. And once he started, people would start, and it was a wonderful way to listen. It was a wonderful way to get people to share their stories. And the hesitation, I sat in on a few of them, was so apparent. Nobody was going to say I broke the rule until he said, of course you did. You know what rules to break. Help me to see those. And so we're going to put you into a small breakout rooms and ask you to just, one of you perhaps do a quick intro. One of you perhaps would tell a story, and then try out one of the methods you've heard today. Is it Marshall Ganz's? Is it from the poster that we just saw? One of you would tell a story, and we want the others of you to listen. And we have about, let's say, 12 minutes or so. So what I want you to focus on is telling a story for meaning and listening for meaning. And then if we have time, swap roles so that maybe we can get 2 stories in 12 minutes. Okay? So hopefully we're going to go into breakouts. Bob Klaber is much better at this than we are. So we'll have to hope that this works, and we'll see you back in 12 minutes or so.
Great. I think I've managed to bring everybody back safely, which is brilliant.
Yes, it is.
Nikki, do you like to start?
I'm going to volunteer Bimby from our group to share his story because I thought it was a really lovely one. I hope, Bimby, that you're comfortable in doing that.
Yeah. Thank you for that. Hopefully you can all hear me. So I think the story was of perhaps breaking the rules and potentially demonstrating something quite deep that's important. I had a work experience student follow me and shadow me as a surgeon at the Royal Free Hospital, and brought him into the operating theatre to observe this. So I explained the do's and don'ts, and he sat through a local anaesthetic case, and I sort of sat him in the corner to make sure, he was sort of safe. And I was checking with him and explaining things to him at certain times during the operation. And there are other members of staff in there. And then I noticed there's a time where he shuffled his chair so that I couldn't see him, and he was on the other side behind the screen, where all the drapes were, and I couldn't quite figure out what he was doing. But he obviously went up to the patient, and I looked around at the other staff, and they, unfortunately, one of the nurses happened to be on her mobile phone and was sort of immersed in something and hadn't picked up on this. So the operation finished, and I went and spoke to the work experience student and just said, do you realize, first of all, I put you in the corner, what caused you to move over to the patient? And he said that he noticed that this patient was moving around and seemed to be in discomfort. So he went and held her hand. And in other words, he broke the rules within limits and within reason. But he broke the rules, but demonstrated something quite deep there, which is kindness and compassion. And delighted to say he's in the 5th year at Cambridge studying medicine, and I'm sure he'll be a fine doctor. But that stuck with me, and I thought that was a fantastic demonstration of kindness for someone who was just over 18 years old at the time.
Fantastic. Should we listen to one more, and then maybe Maureen or Gabby wants to comment? Jill Phillips, who shared some stories from your group?
Well, Maureen was chairing our group. We had some good stories, didn't we, Maureen?
Could someone share a short version of one of the stories?
Or shall I tell you a snippet of my story?
Yes,
I think
go ahead, Jill.
I said at one point that something I heard from somebody was a good death means a good bereavement for the family. And I was sharing the story about how, like, a small part of my mum's journey, and my mum died 6 years ago today, so I've been thinking about her a lot today. It was one night when she was living in an assisted living home, and she had a bad fall, or not a bad fall, but she had a fall, and the paramedics came, and the obvious thing was to bundle her off to hospital. And I know that if that had happened, she would have deteriorated and died in hospital, which wasn't her wish. and the paramedics worked with me they stayed for about 2 hours talking to me, talking to mum, rearranging suggesting some equipment, suggesting some local help, and basically went away. And we were able then to get mum to go to a hospital, which is what we all wanted. So the kindness, and we were talking about how that doesn't show up in statistics. You know, that would have been a paramedic visit, and I don't know what would be recorded formally, but informally, they were the people that really made the difference to me, just through their kindness and attention, really.
Thank you, Jill. Maureen and Gabby, maybe we take it one more. Ben, Alan, what did you talk about in your group?
Yeah, so the conversation that we had, I won't say who it was, just in case they don't want it to be shared in the full group, but it was one around bursting into tears whilst giving a diagnosis about a child, a really serious diagnosis to the dad, and then to the actual child, and then the mum came and you know, just broke down in tears whilst trying to be professional, and we had a conversation about that, and then we started talking about vulnerability and this idea that I think probably a false idea that leaders are supposed to have it together and be strong and command, or you know, authority, and the idea of kind of becoming tearful or vulnerable is a sign of weakness, and we were just unpacking that, really.
What do you hear?
Amazing stories. I guess that the stories that I've heard from all the three of you and in our group, a few reflections. One was that the idea of breaking the rules came through so many times. And what that says to me is that we, perhaps all of us, can start to think about, how do we reestablish the rules in healthcare? How do we make it so that people aren't fearful or hiding and trying to do something out of kindness for a patient member or a family member? It goes to what you were saying too, Ben. You know, how do we really redefine caring as not only clinical excellence, but kindness and compassion? And so it says to me, a culture change is needed, and all of us, I think, can start that movement. So we heard about breaking the rules quite a bit. The other thing we heard a lot about was the kind people who went out of their way, as all three of these stories, to do something that perhaps was a little bit different. And all of the stories that we were hearing, the patient got better care, what they wanted and what they needed. Family members included. I was telling the story of yesterday with my sister. I was with her the whole time pre-op, and then they said, okay, it's time to go to the operating room. And they said, come on, we're walking her. And they had me walk my sister into the operating room, right to the door. It wasn't like, you're excluded and we're going to put her on a stretcher and take her away. It's like, come on, let's go. And my sister, she was talking about that all night and all day, that little thing and change. And the third thing was, in all of the stories we heard, when we asked what mattered to someone, and when we did with something with kindness, it ended up to be less expensive for the healthcare system. So it's such a wonderful solution for better care, better lives, and lower cost when we consider empowering people all the way through the system. Thank you all for all your sharing. Gabby.
Yeah, I won't add much more. One thing that really came up in our room was, we had two stories. One about when someone had broken a rule, and one about when someone hadn't. And I think what I heard from that is how scary it can feel to break a rule, and how scary it can also feel to have chosen not to, and that everyday staff have to make that choice, and that those environments that we're in, like that moral injury that we talk about, like here we're talking about it as rule breaking. And I think from Bimbi's story, what shouts out to me that we've spoken a lot about is that when I was going through medical school, and a lot of you might have felt this going through training, I was often told to do things that I wouldn't have wanted as a patient if my doctor did that, or to say things that if someone said to me, that when they were telling me bad news, I'd be kind of like, what are you what are you saying? So I think that part that Maureen said about really rethinking how we teach and how we also bring people into the spaces when we bring them in as medical students, and like respect them and kind of share the space and share not our vulnerabilities but why we do this work, like going back to storytelling, why you're there, and like thanking people for doing the thing, that for that medical student going to hold a hand, rather than like infantilizing it or being like, oh, that's so great that you like took the initiative to do that, when that's something that they've like, being really genuine and honest, I think, when we're and like vulnerable, and that maybe I wouldn't have the confidence to do that anymore, and I'm glad that you took the step to do that. I think there's a lot of learning that we can do from people that aren't like maybe as trained, because I think we do have a way of training kindness out of us in the natural way. But no, thank you so much. I've loved this. I love hearing stories from all of you, because you have learned so much. I feel like I've seen so much into your lives in that short 12 minutes. I guess the only thing before I was going to hand back to you, Anne, is that we normally set up what's coming in our next session, and I'm saying that with no idea at the top of my head what's coming in our next session, but I can see Nikki, and I feel like Nikki, you do know.
So, Nikki, are you there still?
She's coming.
I'm very sorry. I can't remember what the next meeting is, but give me 1 second, everybody. I am going to.
Also, I have it. See, this is what happens, and Bob's going to see this on the recording. This is what happens.
It'll be like, team. Okay, go.
I'll tell you.
Okay, so it's still to be confirmed, everybody. Watch this space. It's going to be something very exciting. But from what I can see, it still needs some firming up. There are plans in the work, and we've got following that a couple of months of amazing speakers also looking at things like equity and access to education inside the healthcare realm and so forth.
Well,
sorry, I can't give further details.
No, sorry for asking you to, Nikki.
Gabby and Nikki, thank you very much. And I think that Maureen and Gabby needs a salute or some applause from our technical device, because you made this hour to a rememberable hour for all of us.
And, I would just ask that all of you take the homework from what Gabby was saying. When we start to think about telling a story, it's very powerful because it moves your heart, and it also can give you new ideas. But then it's me, our story, then us. How can I engage other people to help me think about a better system? And then now. And I think that going back to that framework will really help us to mobilize, because we've got a lot of work to do, as we've all discovered today.
Exactly. And this is radical customization and positive service at the same time. And kindness helps us to bring it to reality. So thank you very much, all of you. We were about 45, 50 people when all joined. So I hope all are ready for the next call in August. You will get an email from Bob. Thank you very much for today.
Thanks, everybody.
Thank you.
Thank you so much. See you later for the breakouts.
Bye.
See ya.
Bye.